What comes up with skin boosters is very simple. Skin boosters are mainly done for improving the skin hydration. It just helps with retaining water under the skin. That is the main idea of skin boosters. So they are made of hyaluronic acid, which is one of the substances we use in fillers, and also is a substance we have in our body, and it does work very, very, very well. And that idea why we have hyaluronic acid is mainly to retain water. Actually, hyaluronic acid can retain its weight in 10 times or more than almost 100 times in water. So what happens is we have that substance in our tendons, in our skin, in our joints, and it works as a lubricant and a shock absorber. But when you use it under the skin, it actually retains water. So what we do with this substance is they are it's lower concentration of hyaluronic acid than the fillers that give you volume, and you place them under the skin, under the epidermis, very superficial, in an area where you can actually retain water there. That gives you some plumpiness, and it looks better. The problem with this substance, because they are so light, is they don't last very long. So what we need to do is to repeat the treatments more often, that's it. And we have two products that we can use for that. One is what we call the skin boosters, which is this hyaluronic acid is what we call cross-linked. So it's a little bit, the structure of the molecules are a bit changed, and we cross-link like a net. So it takes more time for them to disappear, because we have an enzyme which is called hyaluronidase, which destroys hyaluronic acid, and is a natural enzyme we have in our body also. So the one that we produce has a turnover of 72 hours. So every 72 hours, it goes away, and you have to produce a new one. The cross-linked can last up to 3 months, the skin boosters. When it comes to fillers, if they're more cross-linked and higher concentration, they can go up to 1 year. So, but with the skin boosters, it's different because you don't want to give you volume, just want to get improving the skin quality and hydration. So that's why they are a lighter appearance and lighter build-up. By that, you place it under the skin, and they have to be done by injection, and we can do like mesotherapy and very, very small spots of injection, or we put in, and that's my favorite approach, with a very thin cannula right under the skin, very close to the dermis, where you need to get the water to get the plumpy effect. At the same time, because you stretch it in a very superficial way, if you place it over bone areas, like the mid-cheek, it can also give you a bit of a lifting effect. The same thing works on the jawline, the same thing works on what we call the nasolabial folds. The other thing is what we call a bio-revitalizer. That's a different story. We use hyaluronic acid also, but it's not cross-linked. So it means it tends to go faster, tends to go away faster. But that is mixed with other things, and it works as a carrier for taking vitamins, even neurotoxins inside, and we place it in the skin as a mesotherapy, using a gun, using a needle, or using some devices like a skin roller or some microneedling also to get it through the skin and to be able to get. Both of them, we have to repeat the treatment. So it's not something that you do like every 6 months or every 8 months. No, this we have to do it in a different way. So the protocol usually goes like this. You do 1 session every month for 3 months, so 3 sessions. And then depending on your skin and depending on your stage, you can repeat it every 3 months or every 4 months. Back in Portugal, it was very, very popular treatment before the season, the beach season. So by June, July, we're doing it. And after you come up from the beach, because the skin is tired, the skin is being exposed to the sun, is dehydrated, and you do it again to recover. Also, it was very, very popular to do it before, like 5 days before a party or an event, because it gives that glow and that appearance that is better and more healthier than we think. So it's a very, very good alternative as a treatment for a very fast, quick result. So these are the mainly 2 options we have for skin boosters.